Hi, my name is Shannon Hamilton, and I'm a second-year DAT student at Indiana State University, and I've been a certified athletic trainer for 3 years now. So today I'm going to talk to you a little bit about what an athletic trainer is, as well as go over patellar tendonitis, especially for a college-level athlete. So, athletic trainers are highly qualified healthcare professionals that work with physicians and other healthcare providers to prevent different injuries from occurring, emergency care situations, clinical diagnosis, therapeutic intervention, and rehab of injuries and medical conditions. So, athletic trainers provide medical services to all types of patients, athletes, performing artists, firefighters, industry workers, and the list goes on and on. And we're able to help reduce injury and shorten rehab time for our athletes or any of our patients, and to provide patient education throughout the whole process. So today we're going to talk about, like I said, patellar tendonitis and kind of an explanation of this injury. It's a very common injury in college level athletes, especially with people who participate in jumping types of sports like volleyball, basketball, high jump or long jump, and track. And it happens when the tendon that connects your shin bone or your tibia to your patella or your kneecap becomes inflamed. And this inflammation occurs due to repetitive stress on the knee from these repetitive types of motions. This stress creates tiny tears in the tendon, which inflame and cause the tendon to weaken and experience pain. So some risk factors that can contribute to this injury would be tight lower extremity muscles, uneven muscle strength, misaligned hips, obesity, improper shoes, and hard playing surfaces. And then some of the signs and symptoms of this injury would be pain and tenderness at the base of your kneecap, some swelling or burning, pain that's common with kneeling down or getting up from a squat position, and then pain that is initially more sporadic and only occurs with activity, but then gradually progresses into interfering with all daily activity. So now that we've kind of gone through an explanation of what the injury is and how it might feel, we're going to look into some of the treatment options for patellar tendonitis. So treatment kind of depends on the severity of the injury. The first steps usually are going to be to strengthen and stretch the surrounding muscles, and then also to ice and foam roll to help to manage the pain. There's also some straps that can be worn to alleviate some of the tension that's placed on this tendon when it becomes inflamed, and these straps can be worn during activity to help reduce the pain. And then we also can look into over-the-counter drugs to help reduce inflammation and pain. So if patellar tendonitis is appropriately treated and we follow these steps that I talked about above, this injury could last around up to 3 weeks, but it kind of depends on how severe the injury actually is. It might become a chronic condition that you would just have to manage and maintain while participating in activity. So for mild injuries, like I said, it could last up to 3 weeks, but more severe cases could last up to 6 months or more. So that kind of is the summary of patellar tendonitis, how to identify this injury and what it might feel like, some of the risk factors that could cause this injury to occur. So if you identify with any of these risk factors, you can address it now, and hopefully we can work together to make some modifications and prevent this injury from recurring. And then we also talked about the treatment for patellar tendonitis and how long it might take to actually treat and help this injury. So, like I said, my name is Shannon, and I'm going to leave my phone number and email address if you have any additional questions. Don't hesitate to reach out, and I can help to educate you more on this injury and other injuries and help to prevent these from happening to you. Thank you.